let me start off by asking, have any of you guys ever had difficulty swallowing? Condition dysphagia is very common. In fact, it's one of the most common conditions we see in our office. And basically, I see patients that come in and say, you know, sometimes I'm eating and food just kind of has a little difficulty going down, or it gets hung up on the way, or sometimes liquids go down the wrong way, so to speak. And it's a very common thing, but sometimes it could mean that further tests need to be done and further evaluations need to be done, because it can range from something pretty common that you don't need to worry about to something potentially serious. And I'm going to talk to you about the three main reasons why that happens. So, a lot of times when people have difficulty swallowing, we don't realize how many muscles it takes to actually do that. So, whenever you take a sip of water or you eat some food, it goes in your mouth, and you have a lot of muscles here in a part of your body called the oropharynx, and it takes a lot of muscle strength to push that food down. So sometimes when people have difficulty swallowing, it's because those muscles or nerves are very weak. A lot of times it happens after you've had a stroke. Sometimes it happens as you get older. Some other disorders like Parkinson's can do it, where you're unable to have the strength to kind of push that ball of food or ball of liquid down. And one of the signs and symptoms of that is oftentimes as soon as you start eating, it comes back up, or it comes out of your nose, or you start having coughing, or it actually goes down your windpipe instead of your food pipe and causes shortness of breath. So that's what's called oropharyngeal dysphagia, meaning it's not a problem with your food pipe, but it's a problem with these muscles here. Now, while we don't directly have any diagnostic tests in our practice to look at that, that's more of a, an evaluation by an ear, nose, and throat doctor and neurologist, we'd be able to kind of tell you whether you're having a problem with these muscles or whether you're having a problem with your food pipe by itself, if that makes sense. So what I want to talk to you about today is more so the food pipe problem, or problems with your esophagus that can cause difficulty swallowing.
Now you said Parkinson's disease causes it?
It can, yeah. It can, because it sort of affects a lot of the nerves and the muscles in this part of your throat. So sometimes when food gets stuck going down or liquid gets hung up, it's actually because your food pipe, instead of being a narrow tube, it actually has gotten narrow. And sometimes it gets narrow because of things pretty serious, like an esophageal cancer. But a lot of times it gets narrow because of acid reflux. So let me tell you how that sort of happens. Your stomach has a lot of acid, and that acid in your stomach is very, very strong. It has to be strong to digest vegetables and meats and things like that. But if it refluxes, which means if it shoots up into your food pipe is not strong enough to handle that kind of acid. So what happens is your food pipe starts forming scar tissue to protect itself from the acid. And just like a pipe rusting from the inside out, your food pipe just starts getting smaller and smaller and smaller. And I don't know if you've ever had any friends or family members ever say they need their food pipes stretched out. That's why. Okay, because you formed what's called a stricture, and 99% of the time that's due to acid reflux, whether you know it or not. So, ma'am, you raised your hand and said you do have heartburn, right? So, a lot of times patients will have symptoms of typical heartburn, but sometimes when you have acid reflux, you can have other symptoms, right? Difficulty swallowing, chronic cough, having to clear your throat often, hoarseness, postnasal drip. The list kind of goes on, because again, if acid goes anywhere else besides your stomach, it's going to cause a lot of problems. So one reason why people have difficulty swallowing is because the food pipe is narrow. Another reason why people have difficulty swallowing is because the food pipe itself is sort of going into spasm. And what causes that spasm, again, is acid reflux. So if acid shoots into the food pipe, a lot of times it causes the food pipe to kind of move sort of haphazardly. Instead of going down in a nice smooth motion, you kind of get spasms, and that's why people get choked once in a while, not always. Okay? And a lot of times, again, that is due to acid reflux sort of irritating the food pipe and causing it to move a little differently. Sometimes as we get older, the food pipe naturally gets a little bit weaker and causes what is called dysmotility, where things just aren't moving as fast as they used to. And that's another common reason why people have difficulty swallowing. The third main reason why people have difficulty swallowing sometimes is because the food pipe looks normal, it's moving normally, it's just within the food pipe you have inflammation or you have ulcers that are forming within the food pipe. And again, a lot of times that's due to acid reflux. You kind of see a common theme here. A lot of it is acid related. But sometimes you can have abnormal cells for other reasons, precancerous cells, allergic reactions within your food pipe that can cause that difficulty swallowing. So whenever I see a patient in the office that has difficulty swallowing from whatever reason, I first try to determine, is it a muscle problem up here or is it a food pipe problem? And a lot of times it is a food pipe problem. And I kind of determine that based on the history, how often it happens, when during the meal does it happen. And if I think it is a food pipe issue, the first thing I do is just start acid reflux medications. Like I told you, a lot of the stuff is acid related. But because there's always a possibility of a cancer, there's always a possibility of a narrowing that needs to be stretched out. For anyone that has difficulty swallowing, I recommend a test called an upper endoscopy. Has anybody had an upper endoscopy before? So for those of you who hadn't had it, it's a very easy test. It's much easier than a colonoscopy. I'm sure some of you guys have had a colonoscopy. It's a pretty easy test that we actually do in the office, where we take a look down the food pipe. You go to sleep, you don't feel or remember anything. And what I do is I take a little camera, probably the size of this pencil here, and take a look down your food pipe, look for ulcers, look for inflammation. I see how the food pipe is moving. I can stretch out the esophagus while I'm in there. And how do we do that? We have dilators that go down the camera that we're looking down with and sort of stretch out the food pipe to what the normal size should be. Sometimes we have balloons that we can kind of put in there, inflate and sort of stretch it out. While I'm there, I look at the stomach and I look at the small intestine, take biopsies. And having said all that, the procedure only takes about 2.5 minutes to do. And then you wake up and you go home. So why are we talking about dysphagia and difficulty swallowing? Because sometimes it can be a medical emergency, right? And let me tell you how it becomes a medical emergency. If you're eating something like a piece of steak or a pork chop and it gets lodged in there, I'm not so much concerned about the food that's stuck in there. I'm concerned about your saliva and other secretions that now can't go down. And if it can't go down, it only has one way to go, and that's up. And if it goes up, it runs the risk of going into your lungs and causing a major problem. Pneumonia, having to be on a ventilator. So what I tell patients is, if you have food that gets stuck, even though it might not happen all the time, and it may just be more of an inconvenience, it could potentially be a medical emergency if it happens and you're unable to get that food down one way or the other. So what I would tell you, if you do have that happen to you and the food's just not going down after 5 minutes, 10 minutes or so, you got to call our office or just head to the emergency room. And then what we would do is we would take a look and kind of remove that obstruction endoscopically, and that becomes more of an emergent situation. So what I recommend is if you have this happen to you, even if it's infrequent, it could be the beginning of something more serious. And that's sort of why I put so much information and so much education out there for patients that this has happened to even once. Because it's never normal to have something get stuck or have it moving slow. A lot of times patients will tell me, well, I just eat too fast. No matter how fast you eat, your food pipe should be able to push the food down as fast as it can go in. So if it does get hung or stuck, that means there is something abnormal. But a lot of times it may just be acid reflux related, but we don't want to take a chance.